So this is my bone video for the axial skeleton. I am going to be starting with the cranial bones. So first, with my skeleton, we have the frontal bone right about here. We have the frontal, the two parietal bones right here, and on the back we have the occipital bone right here. The external occipital protuberance is right here, and what it does is that it is a projection on the external surface of the squamous part of the occipital bone. Moving on to the temporal bone, we have temporal bone is going to be located right about here. So in here we have the temporal mandibular joint, which is going to be right about here. We have the mastoid joint here, the styloid joint, which will be about back in here, right about here. We have the external acoustic meatus, which is right here in that little hole, and the squamous part, which is right up here, usually around the squamous suture. The internal view, there is the petrous part of the temporal bone, which will actually be on the outside right about here. What it does hold is the middle and internal ear cavities. And then we also have the internal acoustic meatus, which transmits cranial nerves number 7 and 8 through it. So moving on to the sphenoid, I'm going to open up his head because the sphenoid is actually going to be located on the inside, if you can see that. So we have the superior orbital fissure, which is actually on the bottom underneath, right about here underneath. It allows cranial nerves to control eye movements to enter the orbit. So, but the internal view of it, we have the lesser wing right here and the greater wing right here. We have the optic canal, which will usually be kind of somewhere right in there. It has the optic nerves to pass to the eyes, and then we also have the sella turcica, which is also going to be right here, and it has the hypophyseal fossa that sits on it. For our ethmoid bone, which is actually right in here, we have the crista galli, which helps secure the brain in the cranial cavity, and we have the cribriform plate, which helps form the roof of the nasal cavities and the floor of the anterior cranial fossa. So moving on to our sutures, we have the coronal suture right here, which separates the frontal bone from the two parietals. We have the sagittal suture here, which separates the two parietals from our left and our right. We have the lambdoid suture, which is right here, and that separates our two parietals from, this would be our occipital bone. And we also have our squamous suture, which will be right about here, and that separates our two parietals from our temporal bones. Moving on to our facial bones, we have the maxilla and alveolar process, which is right here and right here. So this is the maxilla, and this would be the alveolar process. We have the nasal right here, our zygomatic right here, and these are the cheeks, and the two bones that form the zygomatic arch are the maxilla and nasal, and the nasal, so right here and here. We have the ethmoid, which is actually going to be inside the eye cavity right about here. We have the vomer, which you can't really see on this one, but what it does is It has two bones that separate the bony nasal septum, and they are formed by the vomer inferiorly and the perpendicular plate of the ethmoid bone superiorly. Then we have the inferior nasal conch, which should be right inside, which you also can't see. And what that does, it actually helps form the nasal cavity. Moving on to our mandible, which is right down here. I'm going to slightly detach his jaw a little bit to help with this. So we have our body, which is right here. We have the angle, which is right here. Right here. We have the ramus, which is this part right here, and the mandibular condyle, which is right here at the ball. We have the mandibular notch here, and the coronoid process here. To start off with our vertebral column, we're going to go over the curvatures. We have our cervical curvature, which is a concave curvature. We have our thoracic curvature, which is convex. Then we have our lumbar curvature, which is concave again, and our sacral curvature, which is convex. Also, starting with our cervical vertebrae, we have 7 of them. And this is the atlas, and what it does is it articulates with the occipital bone and allows us to turn our head. So we're able to turn our head like this in a pivoting joint motion. What is unique about the transverse processes of the cervical vertebrae is that the facet actually allows arteries to pass through, whereas the facets in the thoracic vertebrae actually have allow for like tubulars to connect to the ribs. So now we have our thoracic vertebrae right here. We have 12 of them, and they connect the ribs to the spinal column. So we have our spinous process right here and our transverse processes right here. We have the body or centrum, which is more noticeable here on the inside right here. And we have the position of the intervertebral discs, which actually are located right in between each of these vertebrae, and it helps cushion the vertebrae as movement occurs. So now we're moving on to our lumbar, the lumbar vertebrae, which are right here. We have 5 of them, and down here we have our sacrum, which also include 5 fused vertebrae, and right down here we have is our coccyx. So now we have our sternum portion, and over here we have our manubrium right up here. This is the body of the sternum. We have our xiphoid process right down here at the tip. This little notch right up here is known as the jugular notch. Last but not least, we have our ribs section. So to start off, we have our true ribs, which are these ones right here. There are about 5 of them, and they're all true ribs because they connect to the sternum all individually. We have our false ribs, which would be these 5 right here, and these are considered false ribs because they attach to each other with cartilage before they attach to the sternum. And then we have our 2 floating ribs right over here. So the head of if you can see, we have the head of the rib here. This would be considered the neck. And if we can see right about here, there's a little tubercle right down here, and that's the rib. And then all of this part right here, so the rest of this would be considered the shaft of the rib. And the head and the tubercle actually articulates with the costal facet of the transverse process, and that's how they connect to the vertebrae. So I hope you enjoyed this portion of my axial skeleton bone video, and thanks for watching.